Welcome to the Innovators and Investors Podcast. I'm Kristian Marquez, founder and CEO of Finstrat Management. At Finstrat, we provide CFO-led accounting, finance, and reporting services to assist clients monetize their business. Stick around to the end of the podcast, and I'll share how you can be our next guest. Now, on to the show. Hello, and welcome to another episode of the Innovators and Investors Podcast. I'm your host, Kristian Marquez, founder and CEO of Finstrat Management. Really excited because with us today we have Avanlee Christine. Avanlee is the founder and CEO of Avanlee Care. Avanlee, welcome to the podcast.
Thanks for having me.
Our pleasure. So why don't we start with Avanlee Care? What problem is it solving in the market?
Yeah, so we are primarily working to bridge the gap between health plans and caregiving families. And so what does that mean? We have about 54 million unpaid family caregivers in this country and a very rapidly growing aging population. And this population of people wants to stay at home, age in place. And the primary person to really help keep a senior at home for as long as possible and keep them healthy is usually the adult children, the family caregiver. And so our mission that we're trying to solve is, can we kind of bridge the gap between this massive group of seniors, their caregivers, and the health plans that are caring for them to keep them at home.
And so what was the genesis behind Avanlee Care?
The genesis behind Avanlee Care was just solving a problem for what I saw as a kid with my mom and her father and mother. She acted as one of the primary caregivers with my grandma. This was 20 years ago, starting, when pre-technology, and they were trying to care for him while he had Lewy body's dementia and Parkinson's. And so for a long time, I watched them do that, manage medications, manage doctor's appointments, just kind of the whole fractured communication around what's happening, who can pick him up. And then it was kind of like the genesis of starting to think about technology that could help people age at home. So that was like the beginning of Avanlee Care.
And so, as you point out, demographics are acting as a tailwind to solve this problem. What's taking place on the payer side? Why are they incentivized to see solutions like Avanlee Care in place?
Yeah, so a couple ways to answer that question, especially right now with a new administration and a lot of changes coming, especially to Medicaid and Medicare Advantage. Medicare Advantage is very interesting. So a very high percentage of health plans, I think about 60% of these health plans, they already have a relationship with the Medicare Advantage members' adult child, but it's underutilized and it's incredibly informal. And so this adult child is usually taking mom to her breast cancer screening, getting her to her annual wellness visit, helping with monitoring medications, making sure medications are being taken, making sure they're being picked up, getting groceries, doing all of the things that typically a paid caregiver would be in charge of doing. And so the value for Medicare Advantage plans, and I think it's really going to be a strategic hedge over the next couple of years, is for Medicare Advantage plans to start looking at this massive workforce that is doing the work of a paid caregiver and leveraging them into the health plan to improve anything from keeping members happy on the plan longer, but also improving star ratings. And so I would say at least, the last 4 months have been pretty crazy in terms of what's going to be next for these programs with the new administration. And I think kind of like COVID overnight, we learned, wow, we do need to have technology to monitor seniors, monitor this aging population, but also too, I think for Medicare Advantage, if things do change the way that they are expected to change, can they leverage in the person that has the relationship with the member that is already doing the work?
Totally makes sense. Then let me ask you about then just outcomes. I understand that, since the inception of Obamacare, there's been a bigger focus on the government getting bang for its buck.
Yeah.
And in this case, you referenced star ratings, and I understand, they've withhold a portion of that payment for the plan to be highly rated, more than 3 stars. So, we'd love to get your perspective of how you see that Avanlee Care is assisting improve those outcomes so that those payers are in a better spot.
Yeah. So speaking of stars, medication management is a 3x weighted measure for these health plans. When we launched our first product, we launched a B2C consumer product. Our bread and butter was med management, prescription refills, ordering those refills, but then notifying caregivers when meds were changed and when they were being taken. Second to that, what we were able to really do was get the caregivers to go above and beyond to make sure that mom or dad was getting to their doctor's appointments. And so those two aspects of managing the chronic conditions, managing those annual wellness visits, coupled with really strong med management and adherence, those two things are very important in relation to star ratings. And so engaging those caregivers to make sure that they're being done by specific dates, but also to being, meds are being delivered. Seniors are not going a week or two without these medications. A lot of Medicare Advantage members over the age of 65 are usually on 4 or 5 different types of medications. So ensuring they're being taken is very important. So in terms of outcomes, if we can show, yes, we're able to make sure that mom got her flu vaccination, she got to her annual wellness visit, these appointments were scheduled, she was picked up and she was taken by her adult child, it's good for the health plan. They're able to get the members to do the things that they're wanting them to do. And then I would say the second piece of that is member retention and satisfaction. I was listening to the CEO of Scan the other day, and he said something so interesting. He said, we need to, we're in a very different country and Medicare Advantage is going to look very different. And we need to stop looking at seniors in 1-year increments and start looking at people, especially on the health plan side of, we're going to be caring for you in your 60s, your 70s, your 80s, and your 90s. And so ensuring that, members are using technology for longer than a year, and then you have the adult children helping drive the adoption of the technology for the senior living at home is very important for the plan, because then they're keeping members on longer, and then you actually have a relationship with the people who are caring
Yeah.
for your member.
I mean, it makes really good sense. Usually when I've heard or participated in conversations around continuity of care, you think about general practitioners, specialists, but you're right. I mean, there's a time element that's involved as well.
Mm-hmm.
And, if a member's going to be enrolled more than a year, I think having that perspective makes complete sense. So it's interesting. You point out, at least in the world of stars, that you have some outcomes that are weighted greater than others, presumably because the clinical impact is higher. What's the degree that you get involved with educating family members to make sure that they're aware that their medication management is really, really important because it can have a deleterious effect on their loved ones?
Yeah, so training and education was the real backbone of our platform. When we launched Avanlee Care 1.0 during COVID, We created our own knowledge base, resource library, and then we saw like the booming rise of AI. So we were really able to, I would say, build that out in a way where now we're essentially we have view of, we know this senior has this chronic condition, we know they're taking this medication, we know that they should be eating this, we know we're fully synced in with any type of Bluetooth, Apple Watch, health kit, Fitbit. We know they're exercising this much or they're not. And within the platform, we actually launched our own caregiver strain index. So we're asking on a weekly basis to the caregiver, can you afford to do this? Have you had to take time off work? How is your sleep? And we're weighting that. And so with that information data, we can actually essentially help better support the person who is providing care for that senior. And I think that that's one thing too that is really important, and it's incredibly overlooked, is caregiving is expensive and it's emotionally burdensome. The average caregiver is providing 20 hours of unpaid work, caregiving work outside of their normal work hours. So these people have, families, they have their own career, and they are trying to juggle the care of an aging parent as well. And so making sure that the caregiver is able to do their job and their mental health is good is very important to us, especially as we kind of grow and scale and the resources that we're providing these people.
I mean, that's brilliant. So tangentially, my wife is a hospice nurse, and I understand it's end of life, but a theme that's come up over the years was just the lack of knowledge of palliative care. And so the fact that you guys are bridging that gap, I mean, that's awesome. And it makes total sense too, as to, why everyone in the care continuum benefits. Because, if just for sake of example, satisfaction is on the table, well, hey, if I can get a reprieve, because I have to take the kids to sports or, I've got work, makes all the sense. You reference Avanlee Care 1.0. If we can get your perspective on, as a founder, what the transition from 1.0 to 2.0 looks like, but also kind of how to play out. Like, how did you do an evaluation, ultimately decision that you needed to shift your focus?
Yeah, that's a great question. When we set out to start the business, this was birthed right before COVID. We did not plan that. I was in New York City. The woman who wrote my first check and is now the chairman of our board is a woman named Esther Dyson. And Esther, I remember I was in New York City and I said, hey, I've got this idea for a company. I'm in the tech world. I was in the senior care space, and no one was really going after this market other than the life alert, help, I've fallen, I can't get up. And I just thought to myself, well, we're launching people, beginning to launch this race for space, like space tourism yesterday, watching women go to space on Blue Origin for 11 minutes. But I just thought, here we are living in a world where technology is so advanced in so many areas of our life, but with this aging population, it's just such an overlooked group of people. It's the largest group of people on the planet, fastest growing group of people on the planet. And so I remember Esther said to me in New York, you have no money, so get out of Manhattan and go back to Montana. And if you ever build it, call me. Best of luck to you. And that was kind of it. And I came back. I went to Montana. I met my co-founder, Chris Munson, who's our CTO. And I was looking for a job in Bozeman. I was like, I need to get a full-time job because I don't know if this company's ever getting off the ground. And so I met Chris and we did this, worked on it on nights and weekends. He really built the first product that we launched, and it started as just a B2C app on the App Store. And then 2 weeks later, COVID happened. And so we got a very decent amount of users, tens of thousands of users to download the platform who were during COVID looking for how do I care for my mom, like med management app. And so we were able to get, I think, about 15,000 users. We averaged about 2 to 3 family caregivers per senior, and we just started like rolling out integrations, rolling out features. We and that's when we got a conversation going with Walmart. We integrated, Walmart was just releasing their online pickup and delivery for grocery API. And so they probably said yes to us because we were the first company that just said, hey, can we integrate into this API? They were like, it's new. It was a very, very complicated task. So now, grocery OTC health and wellness from Walmart are available via the Avanlee Care platform in all 50 states. But then we also, Mark Cuban integrated cost plus drugs into the platform. He was really impressed with the fact that, hey, yes, I actually care about the average or the out-of-pocket costs Americans have. He's done an incredible job with cost plus drugs, and we integrated cost plus drugs in. But it was last summer where we identified truly product market fit. And that was with these Medicare Advantage plans who so desperately needed to, deploy tech-enabled solutions to help them with member experience and stars and how they're being rated and the communication that they have with the member. And so that's when, as a company, we really focused on a purpose-driven product that was tailored to the Medicare Advantage plan, scheduling vaccinations, food procurement, medication management, and then really chronic condition scheduling and the communication around that. And so, and it'll be a SOC 2 compliant product. So we are just out of the audit phase of that. So the dev team's really happy. So am I. So are our investors. So it took a long time.
Congrats. That's awesome. So as you reflect back, do you think the change in hindsight was intuitive, or do you think the process had to play out exactly that it did in order to lead you towards Medicare Advantage?
I think that I understand. So there are things I wish we would have done differently just from a speed to market. But I didn't know, you don't know what you don't know. You learn along the way. And I think that's what's really great about our company is very teachable, and we're willing to listen. I also think you need to listen to your customer, but you also need to you need to understand the market. And had we done things differently, I don't think we would have been here today. I think we had to go through all the kind of the mountains and the valleys to get to the point where we identified the product market fit, and then we understood what the technology needed to do and how to honestly get to mass scale. Because without hundreds and millions of dollars in this market from taking hundreds of millions from a VC, you just can't get a B2C product anywhere. It's just so expensive. But with Medicare Advantage plans, and even too, is there's things on our roadmap in regards to hospital systems. I had a very interesting experience where I had to go be Esther's caregiver here in New York City, and she was being discharged from her surgery, and she got a stack of papers this high coming off of anesthesia. And that at one of the most prestigious hospitals in the country. And that whole experience of the patient discharge is still just, you're caring for her. This is what she needs to do. But if something happens in this window of time and she comes back, it's bad for the hospital. It's bad for the health insurance, but there's just no, I mean, it could easily be uploaded into the chart, the med chart, or the phone of this is what you need to be doing for the next 30, 60 to 90 days.
Well, it's great to see that you guys are taking on, the very much analog world of healthcare, because you would think in the century that wouldn't be the case. Okay, so fast forward to today, it's now Avanlee Care 2.0. Would love to know what you're focused on. Between sales, product development, sales and marketing. How are you dividing your time?
Yeah, right now, luckily we are just full steam ahead, heads down on sales, and launching this product into the bid and into the market. We are also beginning conversations with some pretty awesome things coming around pharmacy, wanting to get kind of like a nationally rolled out either same day pharmacy within delivery through Avanlee Care within the next 6 to 12 months. Maybe not the whole country, probably more like half the country, but working with partners on that. Uh, although my co-founder dev team makes me stay as far away from the product as I can. I'm in charge of selling. So I have a little book they gave me. It's like I write down all my crazy ideas, and then once a year I get to read one or two. So
That's all it takes.
yeah, just takes one or two of those good ideas. So anyway, yeah. So that's what my time is focused on right now.
Good stuff. And so from a budget perspective, or do you find that at this stage it's a lot of just direct face-to-face meetings, or are you carving out a good portion of the sales and marketing budget to do advertising?
Yeah, well, because it's interesting with a B2B in Medicare, even though things are so uncertain, I thought that, so budgets are being cut. I think we're about to see some more mass layoffs, but unfortunately on the health plan side, but they are still sending people to a few of these conferences. I've attended some really great conferences specific to Medicare Advantage. So I've done more of the face-to-face boots on the ground work with meeting health plans, but also too we have a great board with a great group of advisors who have so many years of experience in this space. So we've been able to get a lot of face-to-face meetings. But yeah, from a budget perspective, we're okay. We're good to go. We're pouring all of our resources into this. I think from the health plan side, it's just you see few and few people going and getting out because there's so much uncertainty of what's going to happen.
Okay. Well, hopefully it gets resolved sooner rather than later. I'll remain optimistic. Also love to get your perspective. So if I recall correctly, Chris Munson, your co-founder, over the course of the podcast, one of the topics has been co-founder or no co-founder. Would love to get your perspective on, how things are playing out, knowing that you have someone else that you can look across the table to as you're building the business.
When I was starting this company the first time, I wanted to, go out and do this. This was in New York when I was talking about it in 2018. And I remember Esther said, you need a co-founder who's a technologist. And that was the best piece of advice I've ever received in this company, because without Chris, we would not be here today.
Shout out to Chris.
Yeah, shout out to Chris. Even though you'll never see him on a podcast or TV or an interview because he does not do anything social. But I've had a lot of people I've met over the years who they're solo founders, and they just have so many more challenges in terms of and I'm speaking specifically to if you're a solo founder in the tech space and you don't have a background in technology, that's shaky ground, because I just think you'll have so many more obstacles you have to face. So having a co-founder who I'm very close with, in 5 years, Chris and I have never really had an argument. We disagree on things, but we almost like kind of you're fighting fair because you want to get to a resolution, but he's like a computer. He always just spits out the right answer. And so he's always right. So
Well, this topic of finding someone who complements your core competencies, I think is extremely relevant. And you're right. I mean, I hear it often. You have, I'll oversimplify it, but I'll call it the business side
Yeah.
and the technology side. And obviously there are a lot of founders who have to deal with both. But it's great to hear that your experience has been positive. Because I get the question often, should I go look for somebody? And it sounds like here's another case in point where yes, it makes the case for it. Avanlee, really appreciate your time. Before we wrap up, one of the questions I love asking and closing with is, if you had an opportunity, go back and have a conversation with your younger self, what would you share with them?
Yeah. I keep your blinders on. Just don't compare yourself to other people. Yeah. And other people's like successes. I think as a founder, especially when you start a company, like sometimes I just can't get on LinkedIn because it's always, it's always praise and praise and praise and milestones. And, when you start a company, I always tell people, as a founder, we have maybe I have 2 or 3 good days a year, but most of the days they're very hard, and you're just taking everything every day and figuring out everything going wrong, trying to figure out how to get through it. And so I've learned like a couple years ago, just keep your blinders on, stay focused, don't compare yourself to everybody else. Everyone in starting a company has a very unique story and how they get there. There's no playbook on how to do this. And so just keep going, keep marching forward, and get towards the goal. That's what I would tell my younger self. Now, would my younger self listen? Probably not.
Probably not.
Yeah.
But then you wouldn't be who you are today. So, but for benefits or audience, I 100% agree. I think you see press releases of someone closing, an 8, 9 figure round, and you're like, well, that must have been easy. Where the reality of it isn't. You don't see all the blood, sweat, and tears that has led up to that point. So we do ourselves a favor, I think, by focusing on what's in front of us. Avanlee, if there's anyone who's listening would love to get a hold of you, how can they find you?
You can email me, avanlee@avanleecare.com. Don't LinkedIn message me because I'm not going to check it.
There you go. Good stuff. Well, Avanlee, again, appreciate your time. Thank you for joining us on the podcast. Again, for our audience, Avanlee Christine, founder and CEO of Avanlee Care. And this is another episode of the Innovators and Investors Podcast. Again, I'm your host, Kristian Marquez, founder and CEO of FinStrat Management. Thank you.
If you've got something out of this interview, please share this episode on social media. If you know someone that would be a great guest, please tag them on social media to let them know about the show and include the hashtag Innovators and Investors. I'd love to see your posts and suggestions. We're regularly putting out new episodes and content. To make sure you catch each new episode, please subscribe to the Innovators and Investors Podcast. And your thumbs up, ratings, and reviews go a long way to help promote the show, and it means a lot to me and my team. Would you like to know more? Go to our website, finstratmgmt.com, or follow us on LinkedIn or on X. Our handle is @finstratmgmt. This is Kristian Marquez. Thank you for listening. Until next time.